Ladies and gentlemen, we got Dr. Collier on the line. What is going on, good doc?
Good morning, Head Crack. So glad to have you on the show, have me on the show, and all your listeners this morning. We're going to bring you a coronavirus 19 update.
What is the latest, man? Because there's been some stats that's been coming out and showing how, we as African Americans are definitely in the blast radius because a lot of us have a lot of these pre-existing conditions which are directly affected.
Oh, that's absolutely correct. So let's start off with some basic information here. One, there have been over 400,000 confirmed cases. We have 22,000 recovered people, and we have almost 13,000 deaths from the virus. So the virus is out there. Almost half the amount of deaths have been in New York City proper. So initially, I had to deal with the rumor and the social media information saying African Americans couldn't contract the COVID-19 coronavirus, that we had some innate protection and we didn't have to worry about it. So now that we've dispelled that rumor, now we see that it's disproportionately infecting and killing black people. In Louisiana, 70% of the people who have died through the virus are African American, but African Americans only make up 1/3 of the population. So that is a disparity. In Chicago, greater than half of those who test positive for the coronavirus are African American, and 72% of virus-related fatalities, even though African Americans make up less than 1/3 of the population in Chicago. Now, this data is across the country. We got disparities in Illinois, North Carolina, South Carolina, Las Vegas, and Connecticut. So we're seeing that across the board, that African Americans are disproportionately affected by this and have poor outcomes. Now, part of this is that, one, black Americans often don't have the luxury of staying home and doing their telecommuting and doing their work from home. They often have service professions, or they're riding public transportation like buses and subways to get to their jobs. So they're being exposed in that way. And oftentimes African Americans, we have pre-existing conditions such as asthma. Highest concentration of asthma is in the African American community, hypertension, and diabetes. So we got lots of problems with that, and even go so far as the segregation in our neighborhoods. Oftentimes, African Americans live in high-density populations that basically apartments, condos, etc. And so instead of being in the suburbs and individual houses with a lot of separation, they're in high-density housing, so they're being exposed that way. So many different things are noting for the disparities, but the bottom line is that it is infecting African Americans at a higher rate. African Americans are dying at a higher rate, and so we need to make sure that this is not a problem. If you are sick enough to go to the emergency room, we have documented cases of a situation where African Americans are less likely to be tested. I'm not sure whether it's racial or whatever it is, but the point is that you have to be your own medical advocate. If you're sick, you request testing respectfully. Remember, the healthcare professionals are working on your behalf. They're tired, fatigued, overworked. So you don't want to confront people. You want to passively, aggressively accomplish what you came in for, which is to be tested. And more importantly, even if you aren't tested, because it's not really important whether your test is positive or negative, if you have symptoms, you're considered to be presumptively diagnosed. Then you need to be treated for the symptoms. If you have chest congestion, get a prescription for a decongestant. If you have sinus congestion, get a prescription for an antihistamine. Those sorts of things. Antibiotics if you have a possible secondary bacterial infection in your lungs. So don't just walk out and have them tell you go home and self-isolate for 14 days, because that's not what's going to get you through this. You need to be treated. You need to treat those signs and symptoms, and you need to take care of that.
And now there was rumors going around that they were going to try these vaccines and that they were going to test them in Africa. Now, do you know anything about that? Is there truth to that? And why Africa?
I'm not sure whether that's just internet or not, because they have vaccines that are in trials right now in the United States. But once again, a vaccine is 6 months to a year out. There are two primary therapies that we can look forward to. One, patients that have already gotten the disease and gotten over the disease, they have antibodies in their blood serum now. You can take that blood serum and transfuse it into people that are sick, and that's like instantly having the benefit of a vaccine, because now you have antibodies that will actively treat the bacteria, the viral infection rather. So you're going to have that is probably the first actual treatment is going to become available. They have 70 different drugs that are already FDA approved that they are looking at to treat this, including hydroxychloroquine and azithromycin, everybody knows as the Z-Pack. Now, understand this. They're telling you that hydroxychloroquine has a lot of side effects and you should not be concerned about it, but they write that prescription, and I write that prescription, regularly for people that have lupus, rheumatoid arthritis, and people that are traveling over to Africa, that are trying to protect themselves from malaria, which is its primary indication. And also, more importantly, they're telling you that, but they're using it in every hospital in America where people are hospitalized. People are getting treated with hydroxychloroquine and azithromycin combination. It's the standard protocol in the hospital. They're also adding an HIV drug called retinavir that has shown some great promise. They looked at a couple of drugs that you're familiar with, like Truvada, because they have commercials on television every 5 minutes, but they didn't show any real benefit. But the retinavir showing some benefit. It's an IV treatment, and so you have to get that dose at the hospital. But the hydroxychloroquine and the azithromycin, standard prescriptions that are available in any local pharmacy.
All right, cool. So in closing, I know there's a lot going on. I mean, still the narrative is wash your hands, right? Keep the 6 feet away and all that good stuff, right?
Absolutely, but also, don't become fatigued with doing those things. Wear a mask, but more importantly, wear eye protection as well. You are more susceptible to getting infected through your eyes because someone coughs or sneezes in your eyes, you blink, the virus or the bacteria goes directly down your tear duct into your sinuses. You couldn't ask for a better inoculum. So protect your eyes. Eyeglasses are better than nothing, but goggle-type glasses that will protect the sides of your eyes and don't have gaps, in addition to a mask, are very, very important. And then everybody that's listening should have in their armamentarium at their house right now a non-sedating antihistamine such as Claritin, Zyrtec, Allegra, or Zysol. They should have a chest decongestant and anti-cough such as Mucinex DM. There's a long-acting 12-hour cough syrup called Delsum that I really like, and children and adults can use that, and it will get you through your entire workday and keep you decongested. But then also Tylenol or Aleve, which will take care of fever and body aches. So everybody should have that. Don't wait until you get sick before you go and buy it. Those are the things, and you can see that on my website. Ask Dr. MJ on all social media. We're posting this information regularly. You can find any of it there. And I can send it some to you as well, Craig. We want the Morning Hustle people to hear it.
Appreciate that love, man. Thank you so much, Dr. MJ Collier, man. Thank you for keeping the people safe, and we appreciate your energy, man. One time for Dr. MJ Collier.
Yeah, man. All right.
We are the Morning Hustle.